Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. So this is our continuation video of our fluid and electrolytes, and in this video we're going to talk about fluid compartments. We're going to talk about fluid and electrolyte movement and as well as our IV intravenous fluids. So let's talk about fluid compartments. There are 5 main fluid compartments that we should know, and they go as follows. We have intracellular, extracellular, interstitial, intravascular, and transcellular. So intracellular means it's in the cell, and what do we find mostly in the cell is potassium. And when there's cell death, maybe due to chemo or burns, this will increase the potassium level in the blood. Also, when somebody is in need of a blood transfusion and we need to handle the packaged cells or blood bag carefully to avoid busting the cells. And when we bust the cells, what happens? We'll end up increasing the potassium volume in the bloodstream for this patient. Okay? Extracellular. Extracellular is outside the cells. And what we normally find mostly outside the cells is potassium. And other compartments, which are interstitial, intravascular, and transcellular, are also considered extracellular because they're not in the cell, right? Interstitial. Interstitial is the space between the cells themselves and the blood vessels. It is the fluid in which the cells are floating in. And when edema occurs, which edema is excess fluid, it happens in this space, the interstitial space. Intravascular space. What is intravascular space? Intravascular space is actually inside the vessels, and the fluid and electrolytes inside the blood vessels. It's most important to blood pressure. Why? Because when we have low intravascular fluid, this would lead to low blood pressure and vice versa, means hypertension and hypertension. Transcellular. Transcellular is everything else, meaning whatever is not part of what we've talked about. And what is this? We could say our lymph fluids, right? The fluids in the joints, the cerebrospinal fluid, CSF, and all other areas that are not part of this and contain fluids are considered intracellular spaces or compartments. So fluid and electrolyte movement. This is the way our fluid and electrolyte moves in our body, and there are 4 ways in which this happens, and they include diffusion, osmosis, filtration, as well as active transport. Some key things to remember is things move from a region of high concentration to a region of low concentration, and the second thing is things move from a region of high pressure to a region of low pressure, right? We kind of to get that homeostasis to balance it out. So what is a solute? A solute is the electrolyte. When I say the electrolyte, I mean what? Sodium, potassium, that kind of stuff, they are considered a solute. And what is a solvent? A solvent is water, the dilutant. What actually dilutes? The solute. So let's talk about this modes of transport, right? So diffusion. What is diffusion? Diffusion is the solute movement from a region of high concentration to a region of low concentration. Remember, a solute is the electrolyte. So we could say sodium is moving from a region of high concentration to a region of low concentration. That will be considered diffusion. Osmosis. Osmosis is where water or the fluid moves from a region of high concentration to a region of low concentration. Filtration. Filtration involves both the solute and the solvent, the fluids and the electrolytes. They move from a region of high concentration to a region of low concentration. And for this to occur, we need hydrostatic pressure. And what is hydrostatic pressure? Hydrostatic pressure is the more the fluid, there is more pressure. Active transport. Active transport is our last mode of transportation of our fluid and electrolytes, and it's responsible for carrying charged ions. What is our charged ions? Na at the top is normally positive, yeah? Sodium, positive. Potassium, K, positive, right? Chloride is Cl, negative. That is not a positive charge. And it carries them against the concentration gradient. And for example, will be the sodium potassium pump, and the ATP is required. ATP is what? Energy. You need energy for active transport to actually occur. Lastly, on this video, we're going to talk our IV fluids, our intravenous fluids. And with our intravenous fluids, we're going to talk about isotonic solutions, hypotonic solutions, as well as hypertonic solutions. So let's start with isotonic solution. So isotonic solution. An isotonic solution is a solution which is in balance. When I say in balance, is the solution is the same concentration with our body fluid. So there will be no force or fluid or electrolyte shift. And we normally use this to treat vascular system fluid deficit because it's the same as the body. We just need to expand that volume. And its concentration is as the same as the plasma, thus prevents the fluid shift between compartments. And our examples include normal saline, that's 0.9% normal saline. We have our lactate ringer and 5% dextrose in the bag. When the 5% dextrose in the bag, it is an isotonic solution. Let's go to a hypertonic solution. Hypertonic solution, there is a lot more water compared to the solids, meaning the solids are over diluted. So this will make the extra water to move to the cells. And it's normally used to treat intracellular dehydration, right? So our cells are dehydrated and we put this fluid in our vessels. Since there is more water in the vessels, it will move into our cells and cause hydration. And examples of this include 0.45 normal saline, which is half normal saline. We have a quarter normal saline, a third normal saline. And remember when I was telling you about the 5% dextrose in water? Now, when it's in the body, it becomes an hypotonic solution. Guess what? The dextrose has been used for energy. Let's talk about our last IV solution, and it's our hypertonic solution. So with our hypertonic solution, there is more solutes compared to the water in them. All right. And this is normally used to treat critically low serum osmolarity, and osmolarity is higher than the ECF, extracellular fluid. Thus, fluid shift from the intracellular fluid to the extracellular fluid. So if you have a lot of fluid in, your serum, which is the blood in your vessels, is very overly concentrated, like you're getting that dehydration, and we need to draw the fluid, like the water from the ICF, which is the intracellular, will give you an hypertonic solution to cause the fluid in your vessels to be very concentrated, so that water would shift from a region of high concentration, which will be your intracellular, into your intravascular. And examples of this include 5% dextrose in normal saline. We have 5% dextrose in 0.5 normal saline, 5% dextrose in lactate ringer, 10% dextrose in water, 20% dextrose in water, 50% dextrose in water, 3% normal saline, and 5% normal saline. So one key thing that I will love you to remember is that most dextrose in a solution are hypertonic, apart from D5W. Remember, D5W in the bag is isotonic, but when it gets into the body, it becomes hypertonic. So, before we conclude, I would like us to talk about the RAS system. Since the RAS system is one of the key systems that we really need to know in considering our fluid and electrolytes, and let's start it this way. So there are 4 things I would like you to know about ADH, right? And when we talk about ADH, these are the things I need you to keep in mind. ADH keeps fluid inside the body. How? The kidneys respond to ADH by reabsorbing more water back into the blood. The other thing is it releases when electrolytes get concentrated. When we have too much concentration of electrolytes, ADH is released, meaning that we need to dilute it. And it's also released when blood pressure is low because we need to increase that volume. And it's inhibited when blood volume is high. So let's talk about the famous RAS system. What is the RAS system? The RAS system is known as the renin angiotensin aldosterone system, or pathway, some people call it. And this is how the kidneys help balance the fluid and electrolytes in the body. So how does it work? So when the kidneys receive low blood flow, they release an enzyme known as renin to help increase this blood volume. And how does renin help? So when renin is excreted by the kidneys, it stimulates the creation of angiotensin 1. And angiotensin 1 travels from the kidneys to the lungs, and it's converted into angiotensin 2. In combination with ACE, which is our angiotensin converting enzyme, angiotensin 2, it causes vasodilation, which increases the blood volume since there is less space and more pressure for blood to pulse. And it also causes aldosterone to be secreted by the adrenal glands. Once aldosterone is secreted, it tells the kidneys to do what? To hold onto the water and the sodium and get rid of the potassium, increasing the blood volume. So angiotensin 2 is considered a vasoconstrictor and a volume expander. So it vasoconstricts, right? Makes increasing that pressure, and then also volume expands by telling what? The body to retain sodium and water. That's how it helps maintain the blood volume. So let's talk about aldosterone. So what is aldosterone? Aldosterone is actually a mineralocorticoid hormone. So it's a steroid hormone, and it's released by the adrenal gland that sits on the kidneys. This is how it works. It is released if the blood pressure or volume gets low, and if there is some disease causing it to be released when it's not supposed to. So it could be either a disorder or it could be due to blood pressure that causes aldosterone to be released. It causes the kidneys to hold on to water. It also causes the kidneys to hold on to sodium, and also causes the kidneys to get rid of potassium. So when aldosterone is released, there is actually urine output decreases. And if there is too much water in the body, aldosterone will be inhibited. So when there's a release in aldosterone, it kind of tells the body, all the water that is going out, hold it in. We are not peeing. We need to increase the blood volume. And that's it for this video. I will see you on the next. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.